Acute myeloid leukemia Part 1. Feel free to pause the video to give yourself time to answer the questions. Please note that this information is based on the 2016 revision of the WHO. The cytochemical, nonspecific esterase, strongly stains which cell line? Monoblasts. Myeloblasts stain with which cytochemicals? Myeloperoxidase, Sudan black B, and specific esterase. Pseudo-Chediac Higashi granules are associated with which cytogenetic abnormality in AML? Translocation 821, which results in a fusion between RUNX1 and RUNX1T1. What type of hour rods are associated with translocation 821 in AML? Usually long single-hour rods with tapered ends. Which AML translocation is associated with aberrant expression of CD19? Translocation 821. What does RUNX1 encode? The alpha chain of core binding factor. Core binding factor is necessary for hematopoiesis. Which cytogenetic abnormality is associated with the disruption of the beta subunit of core binding factor? AML with inversion 16. What are the characteristics of the core binding leukemia? The core binding leukemias are comprised of translocation 821 and inversion 16. They can have extramedullary involvement manifesting as a myeloid sarcoma. They can also be associated with disseminated intravascular coagulation, gingival and cutaneous involvement, heart and CNS involvement. The core binding leukemias tend to have a good prognosis if KIT is not mutated. KIT mutations in translocation 821 AML are associated with what immunohistochemical findings? Retention of CD56 and lack of CD19 expression. Increased eosinophil precursors are seen in which type of AML? AML with inversion 16. What do the eosinophilic precursors seen in inversion 16 AML stain with? Naphthyl acetate esterase. Naphthyl acetate esterase does not stain normal eosinophils. I hope you enjoyed this video. To get updates when similar videos become available, please consider liking and subscribing.